One of the things that I just want to really speak to, and it's just basically to what have been presented and my experience working with the coronavirus in Sierra Leone. One of my concerns that I have is that we interject words into our overall work activity, otherwise, in my opinion, which has already been used. So, for example, today we are using working from below, which I am understanding to mean the top bottom approach, and two, the community-led approach. So we also want to be clear that when we make some of these interjections, especially with words like working from below, I'm hoping that we give clarity so that people know that it is either the same or there is a difference. I also share all of the concerns that our various panelists presented, these especially experiences with military officers in the midst of all of the situation. I was responsible for social mobilization in Sierra Leone. And one of the concerns that I also had raised, even in our intra-action review at WHO, is the way we understand social mobilization and community engagement, which I always try to separate to mean that social mobilization is the bigger picture of getting everybody be aware of what is going on. Our community engagement is now the focus, because let us not forget, when pandemic happens, pandemics do not happen in all of the communities. So even in our interventions, there is a focus. The focus to those communities where the pandemic is slightly different from where there are no pandemics. So I just wanted to say, based upon what I've heard today, a lot of efforts have been made have been put into this. But what I'm particularly happy about is that they said power to the people. I am understanding this particular action as power to the people, which means that at the end of the day, I mean, it's not like the policy makers, the scientists, the health workers, the decision makers know it all. We are now saying, and I proudly want to be part of this, we are now saying, give the responses in pandemics, give the power to the people. Let the people also chart their way forward. You provide the guide, because at the end of the day, you know how the disease is working, how it should be done. But when it comes to working with the grassroots people, let them take leadership for themselves. Because at the end of the day, like one of the speakers said, it starts with the community and it ends with the community. Thank you very much.
Thank you.